Hi, I'm Erin Carey. I'm a survivor of mental illness and also a certified integrative nutrition health coach and owner of Sparking Wholeness Integrative Nutrition. Whether you're looking for new tools in your wellness toolbox, a better relationship with food, or just some kitchen therapy, I want to help you spark wholeness in your own life. Recently, I sat down with Dr. Alina Olteanu to interview her. Dr. Olteanu is the founder and president of Whole Child Pediatrics of North Texas. She's the only pediatrician in the DFW area trained through the Arizona Center for Integrative Medicine, and she shared some fascinating information with me about whole body health. Stay tuned, and I hope you enjoy what she has to say. We are recording, and I'm here with Dr. Alina Olteanu of Whole Child Texas. I'm very excited to be interviewing her because she has made such a difference in Rhett's health and well-being and his struggle with respiratory everything. So I'm very grateful to be talking to you, Dr. Olteanu, today. So I would love to know a little bit about you, what brought you to integrative functional medicine. I know you are, one of the reasons we came to you is that you're the only pediatrician in DFW trained with Dr. Weil.
Yes.
At the, I always get the name wrong, Arizona
Center for Integrative Medicine.
Yes. So I would love to know a little bit about your journey to integrative medicine and what brought you there.
Okay, well, hello, and thank you for giving me this opportunity to talk about my passion, which is pediatrics, but especially integrative pediatrics, because it brings together everything that is all the tools that are useful to keep kids healthy and treat them. So my journey started actually in Romania. I'm originally from Romania. I was born and raised there. I went to medical school there. And I came to the United States to do a PhD in biochemistry.
Oh, wow.
Because I love science. So I thought that was the opportunity of a lifetime. So I studied biochemistry, biophysics, molecular biology, and I'm really fascinated with research. So I started learning really the deep science that is behind progress in medicine. But my passion was always working with children. So I did my pediatric residency at Baylor College of Medicine in Houston, and it's a wonderful training center where I've learned to treat the sickest children.
Wow.
I saw the really rare diseases, so I became really good, I think, at treating very sick kids. But my heart was always in general pediatrics. I wanted to treat a variety of diseases. So when I got into the real world of general pediatrics, I've noticed that a lot of my kids are not sick enough to go into the hospital, but they're not well either.
Right.
And unfortunately, that is becoming the so-called normal. So I started to see kids who were on daily doses of Zyrtec for years for seasonal allergies, kids who had chronic runny noses, cough, and then unfortunately a lot of behavior issues.
Yes.
A lot of more severe ones, neurodevelopmental issues like autism and ADHD, to just day-to-day anxiety, depression, or just mood issues in general. And the only thing I had in my toolbox was prescription medication.
Right. Yeah.
So the kids were getting a little bit better, but they kept coming back and they never really got well. So
I know that from a personal level, yes.
Yes, so childhood should really be a time of our lives where we're perfectly healthy, kids are energetic. I always tell parents that healthy kids are happy kids.
Yes.
And they should be symptom-free and medication-free. So that started my journey of looking into other treatment options. In the meantime, I also spent a year after my residency in Africa.
Wow.
I was with a program called the Pediatric AIDS Corps.
Okay.
So I worked in a country called Lesotho. It's this tiny, beautiful country in the mountains that it's landlocked within South Africa.
Oh, wow.
So that was a wonderful experience. And what I saw, a lot of kids with HIV, which now is considered a chronic disease that is treatable. So we had medication to treat kids with HIV, but I saw them dying of hunger. So that really sparked my interest in nutrition. And I started reading and learning more about it. And when I came back, I worked in New Orleans for a couple of years, and it was New Orleans after Katrina. So I started seeing a lot of children who were exposed to toxic stress and who didn't have access to healthy food. There were patches of the city that were called food deserts.
Yes.
So that again, it made me realize of the importance of nutrition and how little training I actually have and how little I know about nutrition. I knew a lot of how, as I said, to treat really sick kids and how to prescribe medication, but I didn't know about nutrition. So I started looking more into other treatment options, and I came across the Arizona Center for Integrative Medicine. And after everything I've learned there, I had a newfound respect for nutrition, especially in children, and what a huge difference it makes. And I learned about other treatment that were considered alternative or complementary or holistic. These are words that we used before, but if they have a lot of science behind them, if they've been studied the way we studied a prescription medication, we can safely incorporate it into traditional medicine. So this is one of the basis of integrative medicine. It's bringing into traditional Western medicine other treatment options that have been used maybe for hundreds of years, but not studied. But now we're having more scientific information, and we know that they're safe and they're effective. So integrative medicine is just using different tools to heal children. So that's what brought me to integrative medicine, and I just couldn't go back to practice just regular Western medicine. I still prescribe antibiotics and steroids and inhalers
I know that.
when needed, but I work a lot with changing the lifestyle, especially nutrition. I work with some nutritional supplements, with herbs. If needed, I refer patients to chiropractic care, to acupuncture. And last but not least, I'm a big believer, and we can talk more about it later, about stress management for the entire family. Because I think that's a very, very important piece of the puzzle when we treat the whole child. Yes,
thank you. I'm so glad you mentioned that, because I know for me, I have always been, because I'm a product of traditional medicine and I'm a product of all the antibiotics as a kid, all the steroids, all the eventually turned into the psychiatric drugs. Like, I've been down that road, and I had to start researching for myself other tools, like you said. And that's what led me to look for other tools for my own children. And one of those tools was nutrition. But I don't think nutrition completes the puzzle either. I think there has to be the stress management, the relaxation, meditation, all the things that I know you believe in, and I'll ask more about that in a minute. But I guess you already answered my next question, which is, how is your practice different? I think we already covered that, because I know you do prescribe especially with respiratory issues. That's such a tricky one, and I've always been grateful the fact that you have been willing to prescribe and really willing to hold back also and be cautious with when to prescribe, and I appreciate that. And this is a side note for listeners, when my baby came in at 12 months old, he had already received 8 rounds of antibiotics in his first 8 months of life. And I think that was very much messing with his immune health and his gut health, and coming up with a plan to help treat his gut health was very, very helpful for us. And I thank you for that. So what do you believe is one of the top health issues facing children in our country today? I know that's a hard question probably, because there are many, but.
Yes. So one thing that I tell parents is that 100 years ago, children were dying of infectious diseases. So the mortality rates for infants and even children under 5 in our country was mostly infectious diseases. Unfortunately, in other countries around the world, still that's probably one of the top leading cause in infant and young children mortality. What I see now, again, unfortunately, is an epidemic of behavior, mood, and emotional disorders. And parents come to their pediatricians first, and not too many pediatricians we were not trained to face this epidemic. We have some training and residency, but we don't have a lot of psychiatric training. So I've noticed this really early in my career, about 10-15 years ago, and I realized that I can't send half of my patients to a psychiatrist. So I went and got a little bit more training in managing psychiatric and mental and mood issues. But then what I've noticed working with integrative medicine principles is that a lot of these problems can be, if not completely treated, at least alleviated by lifestyle changes, nutrition, stress management.
Yes.
But I would say at least half of my patients' visits are related to neurodevelopmental disorder, autism, ADHD, anxiety, depression, mood dysregulation disorders. And I see this starting early on, even in kindergarten, age children, but definitely it comes in waves. I see towards the end of the school year, I see a lot of children with anxiety, or before school starts, or around the STAR test. I think that's the anxiety season.
As a former teacher, I can say that is very true.
Yes, and my goal is to, again, minimize prescription medication as much as possible, or use them judiciously.
Right.
And I explain to parents that it's not a permanent fix. That it's a help for a short period of time.
Exactly.
Until we implement other methods to help children learn how to manage their emotions, improve their nutritional status, their gut health, as you mentioned. There's amazing new fascinating research recently, more and more, about the gut-brain immune health connection. So I always talk about gut health, how to prevent any gut health issues, how to treat and a lot of my kids with anxiety or even focus difficulties, sensory issues, anyone who comes to me with any kind of mood, emotional behavior issues, I always ask them, are you pooping every day? And
yes.
And a lot of kids are constipated nowadays. So I tell them that they're all giggling and wondering why I ask them about their poop. But I tell them, in my experience, everybody's constipated until proven otherwise.
Right.
Yeah.
Thank you. That's, gosh, I have so many questions that I could ask you from that, but I know we're limited time, but I think it is sad we are seeing an epidemic, and that's what I'm so passionate about. It's not just raising awareness for it, but looking at the root causes and what is behind that. And we can't just say, oh, it's an epidemic, let's treat it. We need to get to what's behind it, which is what you do very well. I'm skipping over a question about cold and flu season because I want to ask about, because I think this goes along with it. Our kids are stressed. So how do the stress levels of us as parents impact the health of our children's stress levels? And what can we do to help minimize their stress or teach them to manage their stress? Anything on those lines?
Yes, so I have a good news and a bad news regarding this question. So the bad news is that most children's stress starts with parental stress. But that's also the good news. Parents have the power to change their children's neurochemistry and even rewire their brains to have a different reaction to stress by managing their own stress levels. And I'm very passionate. I wish I would reach more moms even before they get pregnant or when they're pregnant, because a lot of the children's health issues are starting in mom's belly.
Yes.
So moms have a huge role to play, and I think every mom has those huge responsibilities, and unfortunately I see a lot of maternal guilt related to this, but I want to take that guilt away.
Yes, that doesn't help either, does it?
Yes. I just want to empower moms with this knowledge that if they take care of themselves, they're actually taking care of the future generations and the generation afterwards. And it all starts even prenatally, as I mentioned. So when mom has a very stressful pregnancy, her cortisol levels increases, the infant cortisol level, which rewires the brain in a way that makes children more sensitive, more reactive to stress. So in a way, babies can be born stressed. And I see some of these babies really early on, they're more colicky, they have more sleep issues, and when mom is able to manage her own stress level and takes care of her own emotional health, the babies are actually doing much better. There's some really interesting studies about mom's heart rate variability.
Oh, wow.
Yes, and it was shown that when babies are crying a lot or are very colicky, moms are probably more stressed. But when mom is able to breathe and relax, the baby's crying and colic actually calms down.
Oh, that's so interesting. And so many of us are stressed out when we have a newborn just because it is stressful.
Yes.
Period. And that makes sense.
And nowadays we live in a society where moms don't have a lot of support. No. They don't have grandmas and aunts and
or maternity leave.
Or maternity leave, yes. And as babies and children are growing, some children, and I've seen this generation being more sensitive, they're becoming more reactive to stress. So the best thing parents can do for their children is actually to manage their own stress. It's like they tell you on the airplane to put your oxygen mask first. I think that's the metaphorical oxygen mask in real life. So I always advise mom, and I truly want to empower them and give them permission, so to speak, to put themselves first.
Yes.
To self-care is not a luxury; it's really a necessity.
Yes.
And not so much just for themselves, but for the children as well.
That is so true, and I wish I could go back in time and tell myself these things before, but it's really only been in the last few years. I'm a high-strung person by nature, and it's only been in the last few years I've learned to be still through yoga. Yoga's helped me so much, and to just quiet my mind, and it's okay to breathe and be in the moment. And I'm always thinking forward, I'm always thinking about the next thing, and I'm doing this, and I'm doing this. And I think most of us, we live that way, and it's causing catastrophic long-term effects via inflammation, and we're always in fight or flight.
So there's a way to help moms with that, and dads, so caregivers in general. So that's why I'm a big believer in stress management methods, anything, as you mentioned, yoga, meditation, anything that works for parents. And that's the reason I starts today, stress management and meditation class for busy parents. I want to give parents very practical tools, mainly through meditation, on how to de-stress on a daily basis. And through meditation, parents can rewire their own response to stress, and they, through the process of neuroplasticity, they can change their children's brain and response to stress.
It's very exciting.
Yes, that's one of my biggest passion. I think, as you said, we can only go so far with nutrition, and even with supplements, medication. But there's a big part of healing any kind of chronic condition or alleviating is stress management.
Yeah, one of the things that I've picked up in the last year that's my favorite thing to say now is that a body in stress will not digest.
Yes.
So we can be eating 100% on point, everything, grow our plants, whatever, but if we're stressed out, it's going to be real hard for our bodies to digest even the best foods,
Yes.
So I think that's so important.
Yes, yeah, exactly.
I think I've got one last question, because I think we touched on so many things. Just some practical, because we've got, cold and flu season coming up. What are just some tips for getting through that? What are some things that you tell parents to boost their immune health, that kind of thing?
Yes. So I know that the main thing most parents may want to hear are supplements, vitamins.
Right.
But I'm going to mention that last, because
okay, cool.
I think I want us to keep in mind the big picture of how to support a child's immune system. So we really just have to go back to the basics. So one of my first advice would be sleep. So kids need to sleep, especially teenagers. I have so many teenagers, they're coming in with chronic fatigue, and then during the winter they catch every single bug possible. And then when I ask them how much they sleep 4 to 6 hours a day.
Really?
Yeah, so sleep deprivation can really tax the immune system.
Yeah.
The other one is exercise, especially outdoors. A lot of kids may spend some time outside swimming, especially in Texas during the summer, but during the fall and winter months, when it's really more important, most people are indoors. So I encourage children to play outside at least an hour a day. So that will help them decrease their screen time as well, which will help them sleep better. So it all goes hand in hand. And
we all battle the screen time.
Yes. And we do live in a place and time where I feel that many kids are overscheduled with after-school activities. So kids need free time. They need time to just play. So if possible, to allow kids to have an hour after school just to play. Again, my preference is to play outside, so they can relax and reset. And then the next one will be nutrition. So I talk a lot about nutrition based on anti-inflammatory diet principles. So first, eliminate all the bad stuff, which is processed food, artificial dyes and preservatives, a lot of added sugar. And then add the good stuff, which are lots of brightly colored vegetables and fruits, green leafy vegetables. I encourage at least 5 servings of vegetables per day, which is a lot for most kids.
It is.
But there's a way to incorporate that to trick kids a little bit.
Yes, that's one of my favorite things to do. I just shred zucchini into everything.
Yes.
They don't know, and carrots, and they don't know it's there.
Yes.
Anyway,
sorry. And then I focus on nutrition that is good for gut health. So I think kids can develop a palate for fermented foods. All cultures around the world have some kind of fermented foods as part of their staple diet. So pickled vegetables, sauerkraut, those are a few things that kids may accept on a daily basis. And then water. So kids need to stay very, very well hydrated, especially during the more dry winter months.
Right.
And then a humidifier in their bedroom.
Yes.
That runs. I usually encourage them to run 24/7, especially after we start heating up their rooms. Nasal saline before they go to bed, so that it keeps their mucosa moist. It's not cracked, so they're not more likely to get viruses. Again, back to the basics, teach children good hand hygiene and not to put their fingers anywhere above their neck. So their mouth, nose, eyes. And then in terms of supplements, I encourage parents to know their kids' vitamin D level, so maybe check it once a year. And if it's normal, just during the winter months, just supplement with vitamin D. If it's low, a little bit higher.
Okay. And I recently found out, for me, I have it's one of the mutations, that it's really difficult for
receptor mutation,
for vitamin D, and I have 2 copies, so I'm homozygous, right? That's what I always get them confused.
Yes.
So for my kids, I can assume that they might have gotten...
Yes, most likely.
Most likely, so to be extra careful with that, right? To give them more vitamin D during this time, is that correct?
Yeah. Vitamin D, vitamin C. If they don't get it through food, then through a daily supplement. And elderberry is one.
I love elderberry.
Is one of my favorite immune booster. It also has antiviral properties.
Yes, it does. Okay.
So as you can see, I try to keep even their supplement regimen to a minimum, because I don't want to replace prescription medication with supplements.
Yes.
Again, kids ideally should get all their nutrients from food, but very few do, actually. So that's why we try to boost their nutrition a little bit, especially during the winter months.
Yeah, that's so helpful. Thank you.
And then stress management.
Yes, and of course.
Stress management, yes.
Do you teach kids like a breathing, like 4-7-8 breathing?
Yes,
is that kind of? Okay.
And so that's one of my favorite relaxation breath. And I have a little video on my website that is actually specific for kids. It teaches kids. It's a little cartoon that teaches kids, and it's basically a really simple exercise, breathing exercise, where their out breath is much longer than their in breath. So that way they stimulate their vagal nerve.
Yes. I love talking about the vagus nerve.
Yes. Which switches their nervous system from the fight or flight response to a more relaxed response.
You are speaking my language right now. Very helpful. Thank you. Now, I even found out recently, I don't know why I didn't realize this with all the issues with my kids having tongue and lip tie, but you can stimulate your vagus nerve through the roof of your mouth as well.
Yes.
And if your tongue, if that's not its relaxed point, then you can really struggle with being in more of a stress state. Is that right?
Yes.
I mean,
Yeah, absolutely.
Crazy.
I think our bodies are so miraculous and so smart that I really want to make parents and then children aware that we do have an inner pharmacy that we can awaken through certain exercises, mind-body exercises, and then just to really a basic healthy lifestyle.
That's perfect. I'm so glad that you said that. I think that's a great note to end on. Is there anything else that you want to add?
Just thank you so much,
thank you.
and thank you for what you do, but spreading this message.
Trying to. And you are at wholechildtexas.com. So if anybody wants to watch the video, the stress video with their kids, or get more information, I know you have a lot of good resources on there as well, or the meditation class, or any of those things. So thank you again, Dr. Olteanu. It was really, really great to talk to you, and have a wonderful rest of your fall that hasn't started. Thank you. We are